Hi, my name is Sean Kelly. I'm the Chief Medical Officer at Imprivata and also a practicing emergency physician in Boston at Beth Israel Deaconess Medical Center and Harvard Medical School. Today, we're going to talk about COVID-19 and how customers of Imprivata are using our technology to mitigate risk and manage response to the pandemic. So workflows in healthcare were complex to begin with. The old days of having all of our users in four walls of a hospital with simple workflows are long past, and things were getting more complex even before COVID-19. There were expanding numbers of users and roles that were necessary, from just clinicians to all the other staff around us that help us all do our jobs. And then more and more locations where we need to do work from and access our digital platforms. We work from home, we work on the road, we work in offices, and we use a number of different devices to get online and do our work. We might use more and more smartphones and mobile platforms now than we used to. Sometimes these workflows are delivered via virtual platforms and VDA infrastructure. And that's only been getting more prevalent before this pandemic struck. And we've had the need to go ahead and access many different apps, not just our EHR, of course, which is incredibly important, but a number of other third-party apps to do our jobs properly. So this was all complex before this crisis hit, and now that it has, that has infected our workflows even more. We've had to ramp up, and due to surge in patient volume, we need to rapidly increase our staffing and even rotate between different hospitals and different departments. So that has really placed a stress on the staffing for the different users and roles. And as you can imagine, from different locations, just like the rest of the world, we're doing a lot more work remotely as a physician and nursing workforce. And so that has its challenges, which we're going to talk about later in this segment. I mentioned before that the workflows were complex and that we use a lot more mobile devices. That's certainly even more true now. Everything from patient devices to provider devices to help reduce infection control risk, and also just to allow us to do our jobs in an increasingly complicated workflow world. And then, as far as apps, certainly we still need to get into our EHR just like we always did, but there are even more challenging things we have to do. We're constantly trying to access information like policies and guides and epidemiologic information, as well as coordinate with other institutions around us now that this pandemic has hit. So it's really, this crisis has turned a complex world into a hyper complex. Of course, managing and securing digital identity is actually as important as ever, especially given these hyper-complex workflows. It's really the digital identity, it's the anchor and the control plane for managing the access, both from a security and a convenience standpoint, for all the workers trying to log on and access and transact in this digital world. Of course, one of the major aspects of controlling that digital identity isn't just allowing the access or the workflows, but actually being able to maintain audit trails for compliance and security afterwards as well. So how are customers using Imprivata solutions in their COVID-19 response? Well, first and foremost, they're using our technology to support staffing ramp up and rotating of staff to deal with a surge in patient volume, and then also staff attrition at the same time. They're also enabling inpatient telehealth consults as well as virtual patient visits with family, given the increasing restrictions on visitation rights in the hospital in order to mitigate infection control problems. And we also see just a number of other use cases, and we're constantly getting feedback from customers and working with them to help mitigate risk and manage response to the pandemic in general. So one use case that is quite valuable is using Cortext to send information about patients to family members with a HIPAA compliant platform. So the situation right now is that patient visitation restrictions are in place, obviously to reduce risk of spreading infectious disease, but communicating information about patients can be very challenging. And if you do it through normal channels, it could expose protected health information and violate HIPAA. So Imprivata has a unified communications platform that is HIPAA compliant and secure and enables out-of-network communication between patients and care teams and families And since it's secure and HIPAA compliant and also convenient, it's an ideal solution to optimize this workflow.